So I'm really delighted to welcome Dr. Francesco Zambon and Mick Clifford. Dr. Zambon, for those of you who aren't familiar with Dr. Zambon was the Chief Field Coordinator for Italy and its regions during the pandemic in the World Health Organization. And he was also the lead author of a report which was entitled An Unprecedented Challenge, Italy's First Response to COVID-19. Now, this report was actually taken off the World Health Organization website in May 2020. Now, the report had examined how the Italian government and health system had reacted after the country became the epicenter of the European outbreak of COVID-19 in late February, and noted that Italy went into crisis with a pandemic plan which had not been updated since 2006. So today, Dr. Zambon will outline the retaliatory treatment that he experienced after opposing undue influence to suppress the findings that were in that report. And Dr. Zambon is going to be interviewed by award-winning journalist and special correspondent at the Irish Examiner, Mick Clifford. So, Mick, with that short introduction, I'm delighted to hand over to you now. We really look forward to hearing more from you both.
Thanks very much, Stephanie, and thank you for inviting me to interview Dr. Zambon today. Francesco, thank you for giving us the benefit of your experience as well. Can I start by just setting the scene? As Stephanie outlined, what the problem was, you were the lead author in this report. You were a coordinator in the WHO, and then suddenly you realize there's a problem here. How did that arise?
So first of all, good afternoon, good morning to everyone, and thank you very much for having me in the conference, and I'm very happy to participate, and I think it's very important to speak about these things. So as you said, Mick, indeed, one of the tasks that I was given when I was repurposed by WHO to work on COVID as COVID coordinator in Italy, well, we should recall that Italy was the hardest hit country in those months because it was March, April, May 2020. And one of the things that I was asked more frequently was how and what Italy was doing to counteract the pandemic by other countries. So I was receiving a lot of questions about inquiries by other European regions, by other European countries, and also outside Europe. So the report that we decided to write, and it was a report which was agreed, of course, with all the supervisors and directors, was aimed at really pointing out some of the key messages and the lessons learned from Italy, which could be useful for all those countries and basically the rest of the world, which was behind the epidemic curve at that time, because many countries in March, April 2020 didn't know that they were going to be hit by the pandemic. So the factor time was very important. And what we wanted to do with this report was to give an advantage to other countries, like converting the disadvantage that we had, that we didn't have time, to other countries to better prepare. And so we prepared this report, which is also possible to download from some websites if you just put the title in Google, which was launched on the 13th of May 2020, and less than 20 hours later it was withdrawn. Now, today, we know that it was withdrawn for a number of reasons. First of all, for political pressure directly from the Italian government to WHO, which is in itself something which is extremely severe, because WHO should be an independent body, and it is not. But at that time, the first, let's say, interference with the report, while we were in the final stages of preparation, was by Dr. Guerra, who was a top level official in WHO, Assistant Director General to Tedros, so the Director General of WHO. Basically, he wanted me to change the date of the pandemic plan for Italy. From 2006, which was the date of the pandemic plan, actually Italy didn't have any pandemic plan for any updated pandemic plan for the last 15 years. And he wanted me to say that it was updated in 2016. Why is that? Because at that time, in 2016, he was the General Director for Prevention under the Ministry of Health of Italy. So clearly there was a conflict of interest. And this story basically shows that WHO is not able to publish an independent report, which should be independent by countries, all countries, and also that WHO should guard itself by the interests of its own staff, like in this case, where, I mean, it's quite obvious and self-evident conflict of interest. So the first interference was just 2 days before publishing the report. And then there were other interferences by Dr. Guerra immediately after the report was withdrawn. The report was withdrawn technically for making a correction on the chronology of the pandemic in China, which is in itself a subject which is very much subject to political interferences. So, but once we corrected this mistake, the report was ready to be re-uploaded, but it was never re-uploaded again, and instead it disappeared. Just to mention, and then I will close here, that the story is all but over. Even yesterday, there were 4 articles starting from the first page of newspapers about this censored WHO report. Because on this report, many people lied in WHO and also in the government, including the Minister of Health himself. So now there is a huge debate again. How can we trust an institution who lied at the beginning of the pandemic?
A couple of things that arise there, Francesco, initially. First of all, the report you were compiling, as I understand it, as you say, was designed to help other countries to prepare, not to turn to Italy and say, look at all you have done wrong, somebody must be accountable. It was not dealing with trying to punish or highlight anybody. It was dealing with trying to warn other countries. Yet despite that, this Dr. Guerra, he took it on himself to view it that way. The other thing that strikes me about what you say, I'm just curious, your opinion. If you had said, okay, I will change the report, I'll put in 2016 instead of 2006, as perhaps others might have. If you had done that, do you believe that the report would then have been allowed to go through and would not have been withdrawn?
Absolutely, yes. If I had made that change, for sure, I wouldn't be here. And I wouldn't be especially out of the organization, because I resigned by the organization because well, I guess that we will get to that, but I cannot accept that WHO is basically betraying its own values like transparency and independency. I guess that you are quite right. I think that many other people in my position would have just said, okay, why don't we just make this, let's say, amendment as it is asked by superiors? And by the way, that person was not in the approval chain of the report. That's very important. So basically, we were not even obliged to share the report with him. and that's another mistake, let's say, in the internal procedures of WHO, to allow people to see reports where they might have conflict of interest. But indeed, by changing that date, I would have saved my career, because I was absolutely cognizant at that time that I was about to hit a wall. That was definitely something that I felt in that moment. But if I had falsified the date of the pandemic plan, sooner or later, someone would have found out, and the organization would have been endangered. Absolutely. So in a way or another, the organization was in any case in trouble. But unfortunately, the organization decided to stand by the power. So stand by Ranieri Guerra, by Tedros, because unfortunately, this story involves all the big names.
Yes, and the other thing that strikes me immediately there, Francesco, is this individual, the assistant director in WHO. The criticism, as he would have interpreted of him, was from a time when he was employed by the Italian government. Yet now he was in the WHO, and it would seem that senior management in the WHO decided to treat him as one of their own, to put it that way, to circle the wagons, rather than accept that before you came to work with us, this happened and you must take responsibility for it.
Absolutely. Also because I immediately sent notifications to the ethics office. As you can imagine, in WHO, there is the Office of Compliance, Ethics and Risk Management. So the very same day I sent a warning to the organization, here there is an abusive misconduct of a person who is trying to do something and there is a possible conflict of interest. So the question was, the argument was very clear, and I alerted not only the ethics office, but also all my directors, including the regional director, Hans Kluge, for Europe. So everyone knew, and at that time, the regional director said, you have all my support. Also because this person, this assistant director general, put quite heavy pressure on me, like threatening to dismiss me if I hadn't changed the date. So Hans Kluge, the regional director for Europe, said, zero tolerance for harassment in my region. As a matter of fact, I'm out of the organization. So, and as a result of the fact that despite having sent dozens of notifications to the ethics office, there was a massive cover-up, which was, by the way, made by the same person who made the massive cover-up for the Congo scandal on sexual abuses of WHO. You might unfortunately know that 21 WHO staff committed abuses, sexual abuses. Now it is known as a fact. And the person who covered up these things for a certain time was the director of the ethics office, the same person who said that I was not a whistleblower. And that's quite typical, I guess, as an answer.
I think so, and I've come across that myself, where the first reaction is to say that the whistleblower is not a whistleblower. Yes, I have.
Absolutely.
And what strikes, though, Francesco, is, you know, particularly since the pandemic, everywhere around the world, we have this idea of the WHO leading the fight against the pandemic. And in one respect, your report was a tool, a very valuable tool, to show to other countries, the rest of Europe quite obviously, but then as it spread to the developing world, that this is what can go wrong, this is what you must try to avoid. But rather than use that effectively, simply because of this criticism of one as they saw as one of their own, they just killed the report altogether.
Absolutely. And I also wrote an email to Tedros, the Director General of WHO. So I went up to the hierarchy and I said, the subject of the email was high priority, huge risk of catastrophic, using this word, reputational damage for the organization. And I said what was going on, that the report was withdrawn without giving any explanation, and WHO didn't give any explanation whatsoever for 7 months until the scandal exploded. And then they said that it was withdrawn due to factual inaccuracies. Of course, this is like a big lie, as we know now, because if there are factual inaccuracies, then you correct them immediately. And I even said to the Director General, be careful, because there might be liability for WHO if you are withholding something which could have been useful to other countries, because as any day was passing, then the report was becoming outdated, of course, because knowledge was changing by the minute, I would say. And absolutely, the report was not an evaluation of what the Italian government was doing. Absolutely not, because how could we do that, given that it was written in the full time of the emergency? Or the opposite, it was just a description. Also, the style was written in a very specific way, and it was a stylistic choice to write it as a story. So there was a storytelling of what was happening, how the pandemic unfolded in Italy. And we were thinking, how can we better convey the messages? So we started from describing the story, so with a very strong narrative, also using a language which was like from real life, not the usual bureaucratic language. And out of that, extrapolating some key messages for countries, for decision makers, like that the health professionals were getting infected at a very high pace, that the long-term care facilities were actually incubators of the infection, things that nowadays we know. I mean, it's obvious, but at the time it was not at all obvious.
Absolutely. Now, afterwards, was it pretty soon afterwards that pressure was being put on you, that you felt that people were, that you were going to, there was going to be a reprisal against you in some form? And what form did that take?
Well, I could understand that there was something wrong immediately, because when the report was withdrawn, I was asked by the Director of Business Operation and also Human Resources all possible questions. So who saw the report? Who approved the report? By the way, of course, the report was approved, and it's not that you can publish something on the WHO website if it is not approved, because that was another thing that the WHO, 7 months after, they were trying to say it was not approved. Of course, it was approved. Otherwise, the web team cannot take the liberty of putting something online. And so all sorts of questions I was getting by the senior officers, and I immediately understood, okay, why are they asking these questions as I did something wrong? So as if I acted independently, or I decided to write a report. I mean, it was a shared decision. And of course, I was in continuous contact with the emergency team in Copenhagen, because I was based in Venice, on the development of this report, which was reviewed extensively by many people. So immediately I understood that there was something wrong, and I said to myself, okay, of course they are going to defend the big one, and they will never, ever, especially in such a situation where there was the Italian government then involved, they were not never going to defend me or to take a stand, despite the fact that it is a duty of staff to report wrongdoings. This is according our staff rules. So I just complied with my duties according to the contract. It is WHO, which is a United Nations agency, which breached severely the contract, denying whistleblower protection for myself.
And what was the system like within the WHO to protect somebody in your situation?
Well, there is a very clear policy on whistleblowing. I have to say that before this problem, even the word whistleblowing was not that clear to me, I must say. And this is a very important point to like a take-home message, I would say. Like there is absolutely no culture whatsoever of whistleblowing in WHO. Because there was a policy, but definitely there is not the feeling that you can speak and that you can be protected if you speak up reporting a wrongdoing. So according to this policy, you have to report to the ethics office or to the investigation office. And of course, they have a certain time within which they must carry out investigations to verify whether you are reporting maliciously, and that's definitely possible, or whether the things that you're reporting are correct, and so some kind of actions needs to be taken. So I sent dozens email to both offices, ethics office and investigation, immediately. So immediately from the day I received like threats from this person. They said, okay, we will monitor the situation. Well, it's not a matter of monitoring. Here there was an action to be taken because it was a report which was a drone. So, but they seemed not to care about that. So we will monitor the situation. And basically, there was no substantive feedback that I ever received. Not even when the Guardian, so not the local newspaper, but the Guardian on the 13th of August, like 4 months after the report was withdrawn, of course, someone noticed, and the Guardian said with the head editors, Sarah Boseley, so someone who really definitely knows how to write and how to investigate, was saying, okay, Italy didn't have a pandemic plan. And according to some estimates, if Italy had a pandemic plan, up to 1/3 of the deaths could have been avoided. And the article was continuing by saying, and by the way, there was a WHO report which was stating that the pandemic plan was not updated, was from 2006, but apparently, the Guardian says, the report was taken down by the Assistant Director General, in the name, because he was the director for prevention in Italy, who was, by other things, also, among other things, also in charge of updating the pandemic plan. So not even when the Guardian spoke about it, WHO felt compelled to just give an explanation about this report. Nothing. But something happened though about me. It was like attempts to, how to say, I don't know how to explain. I guess that this is something that happens to all those who are unfortunately in my position. You feel that you are the escaping goat and that you are going to be the escaping goat, that your fate was like already decided. And I must say that in WHO, I stayed for 13 years and I was a coordinator and I made quite a career inside because I started as a P3 and I was a P5 when I left. And I was very much respected by all in the organization, especially by the regional director.
Can I take you back just a small bit, Francesco? You were saying that when this arose and you immediately contacted the ethics office and the investigation office, did you make a specific complaint that should have initiated a specific investigation into your complaint?
Absolutely. There is no form, or like there is not a form which you should fill in order to trigger an investigation. Because this is also something that now WHO is trying, to find an excuse by saying that maybe I didn't make any formal complaint. There is no formal complaint. You just to the point that it can also be anonymous. Instead, I put my name there. This happened. You have to act immediately, and nothing happened. So definitely, I sent notifications to the ethics office, investigation. I contacted the ombudsperson, and given that nothing was happening, I even went higher. In addition to contacting the director general of the organization, I sent notifications to the UN ethics office in New York. So the one which oversee all the UN agencies and also UN investigation in New York. And it was just, it was only at that time, but it was already December, that something happened. Because probably WHO felt that there was something coming from above. And well, now that I'm out of the organization and that I'm suing the organization for not having provided me with whistleblower protection and for having forced my resignation by constituting constructive dismissal, now I'm sending letters to everyone. So to Tedros, to the regional director. I even sent a letter recently to my lawyers, of course, to the Secretary General of the UN, and even Transparency International, together with 40 anti-corruption global organizations, sent a letter to Tedros saying, the way you handled the case, my case, the Zambon case about the censored WHO report is a disaster. It is a disincentive for other people to speak. And in this way, you are favoring a culture of, massive cover-ups instead of allowing people to speak and having the feeling that they are protected. And the matter, the extent of retaliations that I suffered are incredible. It was not a retaliation by one person only. I mean, starting from the person who said, okay, if you don't do that, you will get in trouble, this Assistant Director General. But then all sort of corporate retaliation by WHO, to the point that in December, there was another article by The Guardian when the story was fully fledged. The title was WHO conspires with the Italian government for withdrawing a report. And then WHO was forced for the first time to get out publicly. And it did it in the wrong way by adding lies and by saying that the report was like full of mistakes. So it was putting the blame on me, causing obvious reputational damage. So it was a corporate retaliation through mass media globally.
And you mentioned reprisal, Francesco, that you suffered in the months following it, right up perhaps until your resignation. And you said it got worse. Now, did this take a form? What kind of form it took, first of all, but also, in your opinion, was it such that other people around you had been briefed, had been told something wrong with Francesco, get him, he's trying to do us down, etc., that it was coming from more than just one individual, this assistant director?
Oh, yes, indeed, absolutely. I mean, this is not like an impression, this is like certainty, because, and I can tell you why, because in November, so many months after the report was withdrawn, the report was given, the WHO report. So this report was found on the net by an association of family victims by COVID, and it was given to the magistrates in Italy who were already investigating for neglect epidemic. And the magistrates found that it was very important, the fact that WHO withdrew a report which was stating that the pandemic plan was not updated. So a huge inquiry, legal investigation started in Italy, calling from the Prime Minister at that time to the Minister of Health, to the President of the National Institute of Health. They were all called by magistrates as persons who know facts. This is the persona informata sui fatti. And they also summoned all the authors of this publication, including me, and I was the coordinator, so the 10 authors, plus Ranieri Guerra, the Assistant Director General. So 11 people from WHO were summoned. And Ranieri Guerra, the Assistant Director General, could go to the magistrate and give his version, and of course, WHO's version. And me and the other 9 authors were immediately prevented to go with very harsh letters by the legal office. You cannot go absolutely to the magistrates because you are UN staff, you are protected by immunity. Okay, I'm protected by immunity, but so was also the Assistant Director General. Absolutely, no. So, and so this thing was a huge problem because in Italy, according to the Italian legislation, if you don't present yourself to the magistrates, then the police will come and escort you to the magistrates. And I was summoned three times. And the third time, the summon came through WHO. WHO didn't even inform me that I was summoned and that I couldn't go. I read it on the newspaper. So it was like, Zambon, why Zambon is not coming to the magistrates? What does he have to hide to the magistrates? Just to say in which kind of situation, and you can imagine the stress, I mean, all newspapers need to be speaking about that. You can imagine the stress that WHO put me in, because this is definitely a work-related matter. And in the end, when I was defamed with this communication which came from the press office, as I said in December, I decided to go, okay, this is enough, I will go. And I spoke with the magistrates in my private capacity, knowing that that would be the end.
Well, it appears, I would suggest to me, Francesco, in terms of the WHO, that initially the organization set out to protect the assistant director from what was the truth as compiled in your report. But do you believe that as things went on, and particularly to the point you talk about with the magistrate and all, did they get to a point where the big problem was beyond the assistant director then? It had to do with the whole reputation of the WHO because of how they had conducted this since you first read the report. Are you with me that the problem became a lot bigger for them rather than just protecting this assistant director?
Sure, absolutely. The problem became bigger and bigger because of the mishandling of WHO of this case. They could have solved that, well, of course, they should have solved back in May by not withdrawing the report. But then the problem became immediately much, much bigger, and to the point that now the Assistant Director General is under investigation with a charge of having provided false statements to the public prosecutor. And he was still WHO staff member, and WHO didn't say anything about that. Like, so you might think, okay, if they didn't say anything, how many other people under investigation according to the different member states' justice systems that WHO might have? Because actually they didn't say anything. But I would expect that if there is such a thing, then immediately you take actions with this person. Maybe you put him or her on administrative leave. Nothing of that happened. So, and also it was clear at that point, because the thing exploded, that the minister himself, the president of the National Institute of Health, had a big role in withdrawing the report. So instead of being successful in covering this up, WHO got the opposite result, because it unveiled how susceptible WHO is to political pressure. Because now we know as a fact, because there are WhatsApp chat conversations between the regional director and the Minister of Health, that the report was withdrawn also for political pressure. And this thing in itself is something which should make WHO tremble, because WHO should be independent by member states. It's not. And this thing is known because it went to The Guardian, Financial Times, Le Figaro, Washington Post. It's out there in all major newspapers. The big problem is that apparently WHO definitely has problems, but also the member states are in a way complacent to that, because they all know that there are such problems. But we also know that probably they don't want to solve them, because as a matter of fact, in May next year, the Director General, Tedros, will be re-elected because member states didn't provide any other names. So maybe this protecting this status quo is more important than putting the house in order.
Absolutely. And the other thing that strikes Francesco is we're all aware of organizations where the first thing that management do is perhaps circle the wagons and deny any wrongdoing and point the finger at the whistleblower. And I understand even the term whistleblower has connotations, but you understand what I'm saying. Like, for example, in this country, we scenario with the police, which I'd say is common in a lot of countries, of that kind of thing. But some of us would have thought that an organization like the WHO, with its mission and the lead role it had in the greatest possibly catastrophe to hit the globe in decades, that it's just stupefying that they would go to such lengths and get themselves into such bother doing that, and knowing, and they had to know, that what they were doing was contrary to anything they were supposed to stand for.
Yeah, it's astonishing also for me. Actually, I couldn't believe while reading this story that it was really happening, because I must say that reality went much above any kind of fantasy that I might have had before. Even my lawyers, and my Italian lawyer is an international expert in whistleblowing, when he said, okay, no problem, WHO must apply, because this is the policy, this is the European Commission policy, this is the global policy. They must do this, they must do that. He was regularly astonished himself. Okay, I cannot believe that they are, even the few replies that the legal office gave were just incredible things, not to use other words, because they are just against their own policy, and something which is very easy, to dismount from a legal perspective. But as we know, the reply is always the same. You are not a whistleblower, and you are not a whistleblower because you were not retaliated. They even wrote that. So you become a whistleblower only if you have an actual retaliation which comes first. But this is a nonsense. So it means that I must wait to be killed to become a whistleblower, so that there is a tangible kind of retaliation, because this is what they replied. And as we know also from other cases around the world, this is the standard reply that the lawyers give, like, you're not a whistleblower, you are not retaliated. But in this way, we are not going anywhere. And I think that COVID is exposing the fact that many institutions are all but transparent. And so I think that now it is really time for a change. And despite the fact that COVID is a catastrophe, maybe it could be used to put some orders, not only in the health systems, but also on how institutions work. And whistleblowers should be protected at all costs. Because as a matter of fact, what happened to me? I had a continuous contract, and when I resigned, it means that I gave up also the end of service grant, which was quite substantial money, as I was working for WHO for 13 years. So I went out with €0. I was left unemployed. I gave up to a contract which was worth till retirement $4 million. I'm still unemployed because basically many people want to take revenge on me. In Italy, of course, because the minister is involved himself, and also other high-ranked people, but also in WHO.
If you had to do it again, Francesco, what was there anything you would do differently in terms of how you handled it after you initially blew the whistle or brought to their attention what was going on, and when the report was withdrawn? After that, how you managed things, is there anything you would do differently if you had to do it again?
I think that what I would do differently is just to take a lawyer immediately. So the thing started in May, but in September, October, when I was summoned by the magistrates, the legal office said of WHO, you don't need to have a lawyer. WHO will protect you. Well, I saw with my own eyes, unfortunately, how the organization protected me. So the first thing to do is to hire a good lawyer. And I can see that there is a question about the jurisdiction of the case where the UN fall under. This is a very strange thing which should be changed as well. So when there is such a case like mine, and when you want to contest, when you want to go against the decision, in my case, of not having provided me with whistleblower protection and to have forced me to resign, so constructive dismissal. So you need to file an administrative review, which is carried out internally by WHO Geneva. So it means that any kind of investigation is carried out by one of the parties. So it's all but independent. You might think, okay, of course, if there is a kind of complaint of this kind, there is a third party which is investigating and then they are taking a decision. No. And the lawyers, my lawyer said, you can do whatever you want, but know that you will lose the first two levels and you will have justice only at the International Tribunal of Labor. Because not even, so I already lost the first level, as my lawyer said. Now I'm in the appeal phase, which is still within WHO by people who are nominated by the Director General. So how can we think that they are going to say something different? No? This is absolutely a nonsense, and this is something that I didn't know before. And if I had known that, then maybe I would have thought, okay, do I really want to put myself in such a trouble, given that there's not going to be an independent evaluation of the case? This is why my lawyers wrote also to the Secretary General of UN saying, wait a minute, there is no independence whatsoever in this kind of complaints. There must be an independent review, as it was done in the case of the Congo Standard. That's why we know about Congo Standard, because there was an independent review, which took 1 year, by the way. And who pays the lawyers in the meantime? The legal expenses are enormous, given the fact that I have a number of legal cases open now, and no one is protecting me for that.
Tell me one other thing. Do you believe, Francesco, that perhaps as a result of your case, or maybe with a change of some personnel in management in the WHO, that there could be a better culture there for whistleblowers? Would you have any confidence that things might change in that way?
Well, I have confidence that things might change only if there is some pressure by civil society about the culture of whistleblower, because it's not coming from the member states. This is quite clear. I see that there is also a question about who commissioned the report and what was the purpose. There was a proposal to write this report over a fund which was given by Kuwait, first Qatar, but then didn't materialize, so from Kuwait. So it was approved by all supervisor and all levels in Geneva. So it was commissioned with a fund from Kuwait, which gave $5 million. So these were many other things to Italy, to WHO for supporting Italy. And the purpose was very simple: to share the information that we had available in Italy with other countries. Not having any presumption of saying, okay, what we are sharing, it's like the word of God. No, this is what has happened in Italy. There are some critical issues which can already say that are critical, but there are also some good initiatives, because this report, for instance, contained regional profiles for each of the subnational entities that Italy is composed of. And for each of the regional entity, we were reporting, there was a box like what that region is doing well, or what kind of initiative, like intensive care hubs, for instance, grouping together different regions, or different strategies for testing COVID. So definitely it was not just the bad, but it was a lot of good coming out also from Italy. Unfortunately, it was all lost.
Very unfortunately. Just a couple of questions that have come in here, Francesco. Who commissioned the report and for what purpose? I think you kind of answered, but go ahead.
Yes. Yeah. I answered now to that question. Yeah, the aim was to share information with other countries which were behind the epidemic curve of COVID, and it was commissioned with grants from Kuwait. So then when the scandal exploded, Kuwait complained like for the use of funds. I mean, and they must have asked WHO how come that a report was produced and then it was withdrawn with our money basically. And then they took back all the money which was unspent at a certain time back this year. So Italy also in this way, due to the mishandling of WHO, lost basically $2 million.
Right. And just one other question. What jurisdiction does the UN fall under? Does the new directive apply? The regional office or the office in New York? I'm not clear on that.
It's not the office in New York. For these kind of things, you must apply to the headquarters in Geneva for the first two levels, so the administrative review and for the Global Board of Appeal. These are handled by Geneva, and as I said, this is not independent because they are handled by people nominated by the general director himself, in addition to other people like staff member association and so on. And only the third level is out of the UN system and it goes to the International Tribunal of Labor. But I said before that maybe that was confusing, that I even alerted the New York Ethics and Investigation Office. I did that because above WHO, there is New York UN system. And then given that nothing was happening at the level of my organization, then I decided to go a level above. And it was due to that something happened, because they must have said, okay, what's going on here? And since then, at least my complaint was filed.
Right. Can I finally ask you, Francesco, tomorrow you're faced with the same situation. You're back in the WHO. Pressure's being put on you to change the report. What you now know, would you do the same thing?
Yes, I would do the same thing. Otherwise, I wouldn't be able to watch myself in the mirror. So, because it was a matter of falsifying something or just staying with your duties and do what you think is the right thing. I think that I would do the same thing. As I said, I would hire immediately a good lawyer to get legal advice. And what I wish now for the organization is that there is more culture on respect, because this is something that is preached many times also by the regional director. This is a respectful workplace, and you can imagine it's UN agencies, so the ethics value should be like, but it's not at all the case. I mean, I cannot imagine a worse situation a human being can put in, speaking about work, where you just smash him as much as possible. Everyone is aware of my situation. I mean, this house that you are seeing now is for sale. Everyone in WHO is aware of the situation, and my name is absolutely taboo. I was told by the staff association that whenever my name is raised with the executive management, there is tangible embarrassment. So if there is tangible embarrassment, why don't they try to do something not only for me, but to make sure that this doesn't happen to any human being who is working for such an agency like WHO or any UN agency.
Francesco Zambon, Dr. Francesco Zambon, thank you very much for sharing that with us today. I think I've certainly taken a lot from it, and I'm sure those who tuned in have also, because it is really a lesson in particularly when we think of an organization like the WHO, that unfortunately it has the same failings that even the smallest regional organization or local organization has in various places. And it also would appear to be a very, very cold house for anybody who's a whistleblower. Thank you very much.
Thank you very much for having me.
I'll just hand back to Stephanie there.
Thanks, Mick. Thanks so much. Just a couple of things just to alert you to. Thanks to all of our attendees for staying with us to the end of the session. We've just popped in the chat there some links to some media coverage that Francesco shared with us about his story. So we would really urge you to, if you want to find out more, to please have a look at those different links. Francesco also mentioned that, you know, if he was going through this journey again, he would take legal advice at an earlier stage. So just a quick reminder, I know some of you are new to our work at Integrity at Work and at the Transparency International Ireland, but we actually run a helpline for whistleblowers, the Speak Up helpline. We can be contacted through our free phone, but also online. So the best place to find out information about that helpline is at speakup.ie. It's on the Transparency International Ireland website. And we also have an independent law centre which provides free legal advice, the Transparency Legal Advice Centre. And the way to access that advice is by firstly contacting the helpline. The helpline acts as a type of triage service, initially to help the caller to work out the nature of their disclosure, and can then, if needs be, refer them on to the law centre. So just a quick reminder that that is a free nationally available service that's there for anyone. So all that remains is for me to thank Mick. Thank you so much for a great interview as always. Thank you also for all your work that you do in this area. And Francesco, thank you so much. We don't underestimate the difficulty of what you're going through, and also how stressful and difficult it is to constantly, you know, share this story. But I know, having spoken to you, that you do it so that others won't have to go through what you have gone through and are going through, and will continue to do so. So we do really want to just acknowledge your courage in everything that you're facing, and to thank you for taking part in this session today.
Thank you so much. Thank you very much for having me and for speaking about such important topics. Really, thanks a lot.
Finally, before I leave you all and end the session, I just want to share what's coming up tomorrow morning for those of you who can join us. So coming up tomorrow, we have a session on getting ready for the amended Protect Disclosures Act. So this is a very practical session. It's designed specifically for regulators or prescribed persons and government departments. But even if you're not a prescribed person or working in a government department, I do believe there will be nuggets of really good information there for you. So please do join us tomorrow morning at 9 o'clock. We'll be joined by Pat Keane, who is Assistant Principal at the Department of Public Expenditure and Reform, Orla Crystal, who's Senior Manager in the System Governance area in the Higher Education Authority, Anne O'Connell from AOC Solicitors, and Grania Madden, who many of you will be familiar with, will be our facilitator tomorrow. Grania is founder and senior consultant at GMJ Associates. So I hope you can join us tomorrow morning, and thank you all again for joining us today. Thanks to Mick and to Francesco, and we'll see you all again very soon.